Well, welcome everyone. I'm Dennis Stone, Director of the Center for Advocacy and Social Justice. And also with me tonight is our intern coordinator, Raven Countryman. We have a special guest tonight to talk about the impact on maternal health of the social determinants of health. And I can't think of a better person than our guest to talk about this, Faye Johnson, from the Northeast Florida Healthy Start Coalition, and as executive director. She has a lot of experience in this, and we look forward to your presentation tonight. And with that, I'll turn it over to you, Faye.
Thank you, Dennis, so much. And I appreciate you all inviting me to have this conversation with everyone. It's great that the interest is there, where we really want to dig deep into the maternal and infant health issues that we face and our women face in the community. And as you said, I've been the coalition for many years, and the Magnolia Project, which we're featuring tonight, is one of our initiatives that I will speak heavily to tonight around racial disparities work and the things that we do at the Magnolia Project. So with that, I'll try to get my PowerPoint up and we'll get started. Is that good?
Yes, I also wanted to thank Sunshine Health for their support, as well as others on the call and others that couldn't be here tonight are looking forward to watching this on video. So thank you.
Thank you. I'll stay in the middle like that. Screen.
Okay. I can see your screen.
You can see the screen? Okay. Well, I'll go ahead and get started then. The Magnolia Project has been around since I gotta move this because I can't see my slide really well. So give me 1 minute. Let me see. Move the participants are right in the middle of the slide a minute. But I can talk about the Magnolia Project while we get this in order. It's been around since 1999. We started many years ago as a federal Healthy Start project. We're one of the few coalitions in the state that has the federal Healthy Start program and also the state Healthy Start program as a coalition. We're one of 32 coalitions across the state. The Magnolia Project mission is to improve the health and well-being of women during their childbearing years by empowering communities to address medical, behavior, cultural, and social services needs. Okay. The approach that the Magnolia Project uses to reduce infant mortality primarily in several targeted zip codes. And currently right now, those zip codes that we are focusing on is 32208 and 32209, 11, 77, and soon to focus heavily on 10 as well, as we've seen the infant mortality rate increase in those areas over the years. And so our goal is to work with our women, mainly of childbearing age, or younger or older, but mainly ages 15 to 44 before they become pregnant, during pregnancy, and in between pregnancies and conception. Because what we know about our women, the health of a mother or a woman before pregnancy is so important. By the time she becomes pregnant, the body has already been impacted by many things through the life course. And when we look at Dr. Michael Liu's work around the life course, he speaks heavily to preconception work and the risk factors that many women face long before they even become adolescents, long before they become women, and long before they become pregnant. So our approach at the Magnolia Project is try to work with our women through case management and other services that I'll talk about a little later to ensure that we can support them, particularly around the areas of the social determinants of health. Okay. The Magnolia Project, as I said, has been around since 1999 to address the social determinants of health through a life course model. We offer many services through Magnolia. Have been in the community. We're located on Pearl Street, right in the heart of everything. And before we were on the corner of 45th and I think it was Mine Creek many, many years ago. And so when we located, our participants followed, they stayed with us because the services that we offer, it's not just a service model. It's more of a support system to address the social determinants of health, to address the other ills that they face in the community and give them that support that's needed. Somewhat become their village, so to speak. So these are the services that we currently offer: women health services, prenatal care, well women care, home visitation, shared support groups, which is an empowerment group of women to get together and talk about some of the challenges they face as we believe, and you'll see this later on. One of our things that we truly believe in at Magnolia is listening to the voice of the community. In all of our programs, we need to do that. And so at Magnolia, it's a heavy focus. The Community Action Network is a component of the Magnolia Project. The Magnolia Project also has a heavy focus around stress and stress reduction and educating women on the stressors that are in life, such as the social determinants of health. We also have a freedom section that we're rebuilding, and also our fatherhood and life force group education to include centering pregnancy education that we plan to bring back. So since 1999, the Magnolia Project has been around for almost nearly 25 years. It's a staple in the community. Everybody knows it. The project has served and reached tens of thousands of neighborhoods, residents, sometimes across multi-family generations, which we see. We might have the mom and then you get the daughter as she becomes a mom, and then we serve the entire family. The Magnolia Clinic has served approximately 13,000 women and average over 2,000 per grant cycle. And we're on our, I think, fourth grant cycle, I believe it is, our fourth grant cycle. So every 5 years we have to reapply, and we've been fortunate to be refunded each time. So when we talk about the project area, let me make sure, let me go back, sorry, I went too far. So when we talk about the numbers that we've served, in the chart you can see based on the years, the people that have come through our doors, and over 13,000 have come through the doors. And then another case management component is another service that we offer, not only clinical services, but case management, outreach, community health workers, the whole 9 yards, to help families and women particularly, and fathers, maneuver the systems that are impacting their lives, whether it be the social determinants of health and other systems that are also impacting their lives. The Magnolia Project, case managers and community health workers and clinical team are there to serve those. Currently, our clinical team is provided by Agape Community Health Services. And so everybody tries to work together to make sure that the needs of the mom, the babies, and the fathers are met at this project. And you can see how many contacts through the years and all of the things that we've been, I should say the lives we've been able to touch at Magnolia Project. So you say, okay, well, if you've done all that, then what? So our evaluators have looked across the years of Magnolia, and what we found is that in the primary area where Magnolia serves, you can see a trend line that has formed, and where it's a decrease in the number of infant mortality rates over the trend of Magnolia through the years. And so with the evaluators, what they've done is just looked at the trend, even though it may have been up and down. And what we see is that the project area where in this area, those are the clients that we've served, we've seen a trend of decreasing in the infant mortality rate. That's just in this one small area. That's not for all of Duval County. So I want to be clear about that. But something what we're doing in those areas, you can see that the areas that have decreased and goes up and down, but I want you to pay attention to the trend lines of the Black race and the white race and what is happening in that particular area that we've served through the years. And we continue to stay there, and hopefully we'll continue to do that. And you'll see some other things. Also, Duval County, Florida's infant mortality rate, downstream simply emerging upstream problems. As we look as a whole across the area, we want all of Duval County to have the same trend line. And it sort of is trending that way. It's starting to trend that way a little bit. We still have a lot of work to do though. And I'm thankful that the new administration, along with City Council, and are looking at some of these areas around infant mortality and maternal mortality. So that's encouraging. So we have quite a bit of work still to do, but we're encouraged by what we're seeing, and hopefully we will continue to see the trend lines form in a downward decreasing manner. So with that though, infant mortality still is a problem, okay, especially around racial disparities. And when we look at our infant mortality rate, we can see where the Florida rate, NEF, and based on Florida's rate, Northeast Florida rate is still higher than the Florida rate. So we still, like I said, have work to do, and we're going to continue to do that. Our fetal and infant mortality review work that we do, we're one of the coalitions that has the responsibility of reviewing the death records of the babies that did not live to their first birthday. We're required by contract to review a certain number, and we go deep into the records. A lot of the data I won't share here, but we do have a report that we put out every October on the deep dive into those records and what are some of the additional causes around the social determinants of health and other things that are impacting systems issues, systemic issues, things like that that have gone on for some time. So what we're challenged with, though, if you look at the chart to the right, is that we still see there's a big disparities gap, and we call this the gap right in here. This is where it is. We have our white infant mortality rate is lower, and then our Black infant mortality rate is 3.8 times higher across Northeast Florida. So like I said, we still have work to do, even though in one small area we're making some impact, but we want to make an impact, a greater impact across all Duval County. So you said, okay, Faith, so what's influencing it? What's causing some of these things? What are some of the root causes? When we think about health, it's not all health issues. The social and economic factors, physical environment plays a big part into what is happening with our families and the health of people, period, across the board. Maternal and child health is our world, but I'm saying across the board, whether it's aging or whatever. You know, you have these social determinants of health that also influence. It's about 80% of the problem, where the rest of it, the health issues, is only about 10%. But when we think about the impacts of the social determinants of health, and I'll really get into how it's impacting the body and what it's doing to the body. And then I'll talk about some other presentations that we have and we can offer to you all to really show the impacts around stress and what's happening as it relates to the social determinants of health. But health is one part of it, but it's a very small part. It's the social determinants that are driving the issues around health. So when we look at this, health is more than medical. When we look at the physical determinants, include life force, socioeconomic status, environment, stress, discrimination, intergenerational factors. These are the things that are really contributing to the health outcomes around the social determinants of health. So we have to look across the whole life force. What is mom? Where is mom living? Where's the child living? What's going on in their lives that has impacted that child's life before pregnancy, or when she becomes pregnant, not she, but when the mother becomes pregnant later on in life? What through the years has impacted that? If she is born into poverty and those things continue, whether it be disadvantaged housing, those type of things, all of that drives infant mortality and maternal mortality. It takes a toll not only on just herself overall and her health and her body. It weathers it, and I'll talk about weathering a little bit. But this is what we're looking at when we talk about stress, life force, and those type of things across the life force. So the social determinants of health are conditions and environments where people are born, live, learn, work, play, worship in some cases, age that affect a wide range of functioning and quality of life and outcomes and risk. And this is Healthy People's 2030. And when we look at these things, we see where the conditions in which people are born, grow, live, and work, and I say that twice, to including health systems that could impact outcomes of birth and maternal health also. These circumstances are shaped by distribution of money, power, resources at global level, national and local levels, which are themselves influenced by policy choices. So the social determinants of health plays a big part into our everyday lives, whether it's by policy, whether it's by where you live, whether it's about infrastructure in your community, whether it's by the things that you don't have access to, that others may have access to. All of those play a part. In a very, one of the things that we look at is that studies after studies have outlined the ways in which a woman's health, diet, and stress levels during pregnancy affects her newborn's life chances. Everything from neurological and emotional development to the likelihood of adult obesity. And we see a lot of this play out in the records and the reviews that we do, the death records. We see chronic disease in a lot of our women. In some cases, they have hypertension, diabetes, and obesity all in one. And those things have built up over a period of time. And so by the time she becomes pregnant, her body has already been impacted and influenced by some other things in life, that the contributing factors were around maybe poor housing, where she worked, where she lived, where she worked, where she played, all those things have impacted that. So when we look at that, we say proper nutrition, prenatal care, and exercise are all important, and I agree with that. but class, loving relationships, and place can also affect a pregnant woman's outcome or her baby's outcome. So when we look at the socioeconomic status and we look around and we see where we have many of our women may not be able to, I'll just use this term lightly, make the ends meet sometime. That's stressful in trying to maneuver the systems and not knowing where to go and not knowing what's out there for you. And we think, oh, if she just went and got a prenatal checkup, or she just went and got a well woman's checkup, if she just went to the doctor, it's not all that. There's so many other things that are impacting her lives and the lives of her children that she can't maybe take off from work to go to a doctor's appointment or just a well woman's check, because maybe her business is not offer paid leave. And if she takes off, then she loses money from her check, and then she can't pay her bills, and the cycle continues. So it's those type of things that impact the health outcomes of babies and mothers. Next one. Health disparities, a particular type of health differences that is closely linked with social and economic disadvantages. And I just talked about that a little bit. You can see across there are many areas where you can see the disadvantages that have existed for many years. And unfortunately, there are those that have not been able to move out of those areas and continue to be in that. It adversely affects groups of people who have systematically experienced greater socioeconomic obstacles in their lives to health and to a racial or ethnic group, religion, socioeconomic status, gender, mental health, so forth and so on. And so all of these things take a toll on individual bodies and the health of the mother, the health of the children over a period of time, whether it's lack of education or not being able to obtain certain education because you can't afford it, whether it's going to, like I said, the doctor, but you really don't have the transportation to do that, whether you have transportation to get to your job, and it takes you 4 buses to get there, you already have a child, all of those social determinants of health impact outcomes that we're facing every day. So when we think about the dynamic interplay of social determinants in the context of lives burdened with disparities, influence infant mortality rates. And it does, just as I've said, you can see how it plays out, the social determinants of health, individual socioeconomic status, residential segregation, gender, all of these things contribute to infant mortality and birth outcomes, just the stress along over and over and over. And when you think about stress, and I'll talk about that a little bit, it's compounded every day. If you're in a fight or flight status every day, trying to figure out what's my next move, where am I going to get this from, where that's very stressful, and it compounds the body and contributes to the chronic disease that impacts infant mortality and maternal mortality. The specific determinants of health to explain racial and ethnic disparities in pregnancy outcomes by types. You can look at the socioeconomic, I've talked about that quite a bit, income, education levels, marital status, insurance, food insecurity is a big one, access to quality health care. Having a provider that you feel comfortable talking to, having a provider that you feel that, you may be 10 minutes late, but they're not going to reschedule you because you had to take 2 buses to get there. Those type of community things that happen that our women face a lot of times that we don't know about. Poverty, income, all those housing insecurity, crime, all those things play out through the social determinants of health that has a massive impact on a woman's health or a newborn's health or a baby's and girl's health. So all of those things are very important as we experience discrimination, community segregation, those type of things play out in this as well around the social determinants of health, multi-levels. So once again, a call to action, go upstream. The drivers of health inequities are based on the distribution of experience of the social determinants of health caused by structural determinants of health, cultural norms, institutions, policies, and practices like redlining and Medicaid non-expansion. So we have to look at those things. And when we say go upstream, we look at what's happening. How can we improve the situation, not just put a Band-Aid on it, but go upstream, get folks involved, let them know what's going on. Really try to sit down and figure out how do we address this upstream instead of a downstream approach, if that makes sense. So here are some of the stressors, the social determinants of health, as I've talked about, as a maternal stressor. Income poverty, perceived discrimination, food insecurity, working conditions, healthcare access, all of those contribute to stress in mothers inside the bodies. And what that does, then it affects the maternal health of the mother. Because pounding, if you think about it, if you're constantly in a state of fright and you trying to, just keep moving, you don't realize it, the person doesn't realize it, but your body is being impacted, it's being pounded over and over again by the stress hormones, cortisol, and building up, and it has a grave effect on the body of women and the unborn child. So here we look at weathering. Weathering is a term, I don't know if you it's a book by Dr. Arlene Gianovas that talks about weathering. And weathering is what happens to the body over a period of time, from childhood, from the day that baby is born up until she ages. There's a point where, in most cases, on the curve, you can see with Black mothers, it continues, the weathering effect of adverse perinatal outcomes continues. It does not taper off. It's either way, your best point is right there, but on both sides, you can see where it's going up, both on each side. And weathering is a term I would encourage, us to really look at, because it's an effect over the body over the years and what it does to the body, especially in women. The effects of stress and weathering, being beat down. If you think about a vessel that's going through the water, and I always use this, and it's constantly being battered by the waves and the rocks and everything, and it has this little precious cargo carrying it. By the time it gets to the shore, that cargo may not make it, i.e. a baby, may not make it. Or if he does make it, then there will be some, maybe birth outcomes won't be that great. Very low birth weight occurs, preterm birth occurs, all those kinds of things. So the weathering effect is over a period of time that influences the body's conditions. So if we talk about fetal exposure to maternal stress and what it does, it really can affect the baby considerably. While mom is trying to make it, she doesn't realize she's at stress, but it's causing a lot of issues. And the stress comes from not being able to pay the bills, not being able to get housing, not being able to obtain transportation, not knowing where the next, the meal may come from, those type of things, which are the social determinants of health. So I'm trying to show you how all of it comes together, unfortunately in a bad way, but it does. And these are the things that are impacting the outcomes. Is toxic stress. If you live in that every day, if you're constantly compounded by the social determinants of health, you can't get this, you can't get that, you go over here and you can't get this apartment because of this. It's very stressful, to say the least, but for our women, what can we do? And we look at it as how can we support that? What can we do to support you? And so as we look at the racial disparities in maternal mortality, it's similar to the disparities in infant mortality. The African-American rate is very high. And I know you all have seen a lot in the news lately regarding this, regardless of socioeconomic status. So what is that? What does that mean? People may have housing, they have all this, but what type of support do they really have? And what are the other things that they're encountering, even though they're moving, at a very good pace? There may be some other things that are causing stress on them, even though they may not be as impacted by the social determinants of health. So when we look at the national disparities in infant health equity, you all know the symptoms of disparities in maternal health equity is the same. It's across the board. And we have a lot of work to do. As we just got to keep pushing forward to try to get the information out, get the support out, and keep on, I wouldn't say educating others, but having conversations with others. May not agree, but you have the conversations anyway. You don't have to argue about it, but just, you don't have to agree. But I think it's healthy to have the conversations. So future directions. So we say, where do we go from here? There's so many ways to do a lot of different things. Use your influence, though, and your authority to make change. Or like I said, to have the conversation. I think that's important for us to do. Don't have to agree, but having the conversation is good, because the social determinants of health are real. They are felt by many every day. There are many people that don't have cars, don't have transportation, or they don't have lights, or they don't have food. Those type of things are definitely impacting the health outcomes of our mothers and babies. So we can develop support systems for women throughout the community. I know that is so important, because many, especially during COVID and afterwards, were in isolation, and just having that support system, I consider that as the village. There are many, many women that were able to move upstream themselves because they had a village, even though they may not have had family members for support, but there was always someone there that they could go and talk to, or they could lean on when the lights were being ready to be cut off and things like that, or they didn't have transportation. Somebody took the children for them, or somebody picked them up. So that's a support system that's very important. And if any of you all could build those systems to help in the community, I would encourage that. Identify and advocate for economic development projects in the high poverty neighborhoods. That's so important to change. And we see where we have some initiatives lately that are looking at some of those things. So I'm excited to see what will the outcome of those things be as well. Assemble and establish a board to support the community's economic development, and elevate the voices of the women and girls that are affected by adverse childhood experiences. We need to give them their voice. We need to help support them in their voice. When the women and children, especially our young women, are out there and they're saying things, listen to them. It's important to listen. You know, sometimes we think we know, but we really don't know. So that's one way of going upstream as well, just listening and being a support system for them. So with that, I'll turn here. So one of the other things that's happening, and you all may be aware of this, is the Senate Bill 1606, the Black Maternal Health Omnibus Bill that was introduced by Senator Booker, I think it was, and that it's being looked at, but there are a lot of bills out there, so it may not get through, but at least it's out there, and I think it goes to, I can't remember who it is, it's Senator Sanders, Bernie Sanders, I believe it is, but this is one of the things that we all can do too, is pay attention to these type of bills at the federal level, because some things are happening. This is one that is specific to Black maternal health, around the social determinants of health, and really taking a deep dive into that. It was a committee that was formed at the federal level around social determinants of health. So if there's any information that, if you may have it, I'm assuming that you don't have it, but that we can share with you, please feel free to reach out. And you know, we want to make sure that we have as many voices as possible to try to move some of these things forward. So with that, I'll share this with you. Can you, if I click it? I have to get help with this one. Hold on one minute. That's okay. And I'm not sure if you all were able to see the video or not. Could you hear it?
No.
You couldn't hear it nor see it. Okay, well, I will send that over and share it with you all. Not sure what happened, but it's a actual video that we made that is a tribute to women in the community. So I'll send that, Dennis, and then you can share it later, if that's
Actually,
okay.
I have it up on my screen so I could share it if you're
Okay, could you?
sure.
Thank you.
Hey, mama, this is your time. This is your moment. This is your life. This is your struggle. This is your plight. This is your duty. This is your right. Hey, mama, this is your root. This is your vessel. This is your proof. This is your anger. This is your voice. This is your freedom. This is your choice. Hey, mama, this is your part. This is your revolution. This lives in your heart. This is Anarka. This is Betsy. This is Lucy. This is their honor. This is our truth. Let's connect at hey-mama.org. Brought to you by the Northeast Florida Healthy Start Coalition and the Kids Hope Alliance.
I'm glad you all were able to see it. The music didn't play, but if you want to play it at another time, it's really nice. It's very touching. That was something that our women actually had input into that. And she is a spoken word artist that did that for us. So with that, I will say thank you all so much. That's the end of my presentation. I hope I've shared some information with you all that you could use. And we also offer I think it starts back up in August, a series on stress as well. I think it's the second Friday in August at 12 noon, we do a presentation on this whole stress and how it connects, a really deeper dive into and other than what I did today, it's very deep. And Dr. Christopher at Jacksonville University does that presentation for us, and it's free to anyone. You just log on and listen. So I will give you that. And thank you all so much for allowing me to come and share.
Well, Christina Barcelona says, great information. Thank you, Faye.
You're most welcome. Yeah.
I was listening to Terry Gross. She has a program on public radio every day, and she interviews celebrities. She's been doing that for many, many years. And she now has gotten a co-host, I guess. And I'm drawing a blank on the woman's name. She was in television media for quite a while. Black woman.
Mm-hmm.
And she shared the difficulty of being, the only Black woman in the newsroom that was part of the screen. There were some people, Black, camera people and whatnot, and she just, it was amazing. She's obviously a very accomplished and confident person.
Mm-hmm.
And it was amazing. She shared the challenge of that pressure. And what struck me was, and I've heard of this for years, I remember when I first came to Jacksonville in 1995, I was out jogging and listening on the radio. And this woman was talking about this very thing, that she just lived with it day and night.
Mm-hmm.
And so obviously, if it's a problem for that person, you can imagine what it is for,
Right.
Because you're involved in so many different women's lives.
Yeah. Right.
But anyway, I just wanted to share that. It was
Yeah.
and it was good that she was pointing that out, I thought, and will be a good addition to the program.
Sure.
Any questions for Faye?
Hi, Faye. This is Janice with
Hi,
Sunshine.
Janice.
Hey.
Hello. Hey, how are you?
Hi. Good.
Good.
Thank you so much for that presentation. And I wanted to know the name of the author for the book Weathering you mentioned.
Sure. Dr. Arlene Gianomas, and I can send that to Dennis. I can send the link to his Weathering. It came out, I think back in April, around April of this year. It's a deep read. Yeah. But I can send that link out, Dennis, if you would like. We can send that over to you. You can send it out.
I would love to give this presentation. I know it's great. We had the number of people on to spread the word.
Sure.
But to see this, I would love to see this in a larger arena in some way, because your information is so great, and it just so informative, and it's just eye-opening, even to see the numbers again,
Mhm.
and to know that it's happening, and to know how that maternal health and social determinants of health connects,
Yep,
and it can really determine even the health of our babies, the health of that
that's right.
mom.
Yep.
And I'm so happy that we are in a space, Sunshine Health, where this is of great interest, and we want to be on the side where we're making a difference. And
Sure.
I'm very happy that Dennis was able to get you to speak on this topic. And as he said at the beginning of the meeting, that there's no other person that we know of that would
Okay.
qualify as much as you do to be able to do this. You've been in this for a very, very long time.
Yeah.
And we've been doing social determinants of health for a very, very long time without a
Mhm.
name, but
Right.
helping the community. So thank you, Faith, for taking time out to
Yeah.
do this. We
Oh,
do
for sure.
appreciate it. Thank
For
you.
sure, Janice, and thank you so much for your kind words. I really appreciate it. We just have to stay, we have to just keep having a conversation and coming up with solutions and giving women a voice and their families and making sure that we are there for support purposes, because at the end of the day, when all the programs are gone away and all those kinds of things, they need support. And support will carry them a long way. And I'm not just saying financially. Sometimes I just need someone to talk to and understand what I'm going through. You know what I mean? Just listen to, the lights are off, this is that, and that, but they have hope when they have somebody that they can lean on and be a part of their village. So I encourage that. And thank you guys so much for having me. Thank you, Sunshine Health, for being a true partner, because you all have been in the community for a long time and been a partner right there with us. So I appreciate that.
Other questions for Faye? Well, I had a question. Since you have been in this a long time, what are some of the areas that you've been somewhat successful, where you see
Mm.
a breach in the dike and you're able to move forward?
When I mentioned this, that's why I wanted to feature the Magnolia Project a little bit, but it's a small break in the dike, very small. We're located in one little small area of town. And so we're not all over, everywhere, but I do know the birth outcomes that we've seen of the women that we could get into the program. I get into the setting and stay with them for 2 or 3 years. The outcomes were pretty good. So that's why I'm saying, but it's not all of Duval. It's just one small area in 08, did I get it right? No, it's 08, 09, it's right on the crest of both. So I would say that. And I would say also, Dennis, I think just what you guys are doing here tonight gives me hope that we continue to put the information out. I think that's one of the main things. A lot of people just don't know. They really don't. They don't know how the ills of what's happening and all the other things and systemic things that are occurring that is really affecting the health and the workforce, whether they think about it like that, future workforce, and everything, and the children. So I think just if I were to say that's encouraging, to see that the information is flowing and people want to hear about it. But I think we need to continue to get it out more in more spaces. Yep.
So again, I watched the news hour on public TV, and they've been frequently getting into this category.
Mhm.
And what happens every time is they'll show a chart that has the United States as the worst performer in this.
Mhm.
But
Yeah.
and then they'll say, as they kind of go away from that, and it's double for Black women. And then they just go on and talk.
Yeah.
If they show the chart with the bar twice as high in a country that is wealthiest in the world.
Right.
And yet we're the worst of developing countries.
Mhm.
I was at a meeting last night, and there's an indifference that we have to overcome. And it's work like yours that will help us do that, and getting the word out.
And encourage, because and passing, get looking it out, we have a lot of and Janice knows this too, staff that have been with the coalition for some time, and making sure that these presentations, they're able to do these same presentations. Because when I leave, I don't want everything to leave with me. I want it to continue. I want it to continue and grow. I want it to continue and be. And I think doing that too, really making sure that that's embedded in that group that's coming behind us is important. So the message continuing, the work doesn't stop. Yeah. Yes, I'm good. Yeah.
Other questions?
Hi there. My name is Raven Countryman. I had a question for you. I remember earlier in the presentation, you mentioned something about a men's health initiative. And in that initiative, I wanted to know, will you be using the same tactics and dialogue with men, the same way you've done with women in the past, or is it a completely new, model?
Yeah. That's a very, very good question, Raven. We have a fatherhood program. Actually, Magnolia Project has a fatherhood case manager, and the coalition as a whole has a huge fatherhood program. It's one of the only ones that has been around as long as it has been. And with that, one of the things that my fatherhood director is constantly saying, they make sure we get this information too for our men, for our dads. So he doesn't let us off the hook at the coalition on that one at all. So to answer your question, yes. And what he says is very important. He said, because the whole stress thing, some of our fathers and our men and our boyfriends need to understand that they could be contributing to the stress in some ways. And so it's very important so the Magnolia model itself, that probably, unless you have a lot of money from me, Raven, you gotta have a lot of money to build a model like that for the guys with the health centers and all the other components. I don't see that right now. I wish we could, but at least we have the fatherhood case managers that work with the dads or the guys in the programs as well. So we do have them on our radar and are providing some services for them. Like we don't have a men's health clinic, like we have for the women. But Marcia started some years ago at Magnolia. She had, what was it, Men's Day Wednesday, where the men could come in on one day a week and the Wednesday was their day. So it's on our radar. We're sort of there, but we're not all the way there yet.
Thank you.
You're welcome.
And by the way, I should mention that Raven, our intern coordinator, and several of the interns were instrumental in making this happen. So,
Good.
glad.
All right. And I want to say also to Ms. Marcia Davis, who is on here, she worked closely with Raven. Marcia Davis is the Magnolia Project Director. So the next voice you hear, the next time you hear this presentation, Marcia will be the one. She can do it. But Marcia has been at Magnolia. She's been with the coalition. How many years now, Marcia? About 10, 5? Many years. That's okay. You don't have to come off mute. But she's been with, go ahead.
Close to 20 years.
Yeah, with me. Yep.
What's your perspective on this, Marcia?
I agree with everything that Ms. Johnson mentioned, because we've been in this fight for a long time. The coalition has been around for, like we said, Magnolia has been around since 1999, but the coalition a little longer. And we've been in this fight a long time, just trying to share the information and make sure that people are aware of the social determinants of health. So we're in it to make sure that everyone else knows about it. And like Ms. Johnson mentioned, that this is a great platform, in order to get that information out. So I agree with everything she said.
Thank you. Other questions? Well, I will share that I've been working with the mayor's transition health group, and I'm on the what's it called, the primary care and dental access.
Okay,
And in our recent meeting, this subject came up and we talked a lot about it. So I'm hopeful that the new administration will provide a focus on this and help us bring people together who are all focused on this, but oftentimes are not understanding what's going on.
right. Yeah, I'm encouraged as well. I agree with that. We'll see. And I'm on the, so I saw you at one of the meetings, the Maternal and Child Health Subcommittee. I'm part of that one. So we just got to keep putting the information, having the conversations. Don't stop, no matter what, keep having the conversations.
Yeah, one thing I am looking forward to is the study that's being done that was funded, I guess, about a year ago.
Hmm.
I think Mia Jones is working on it at Agape.
Oh, okay.
And then there's another one. Drawing a blank on who it is, but hopefully the result, they're working with up to 1,000. The goal was 1,000.
Okay, okay. Oh,
And,
mhm.
yeah, so hopefully the results of that will provide some local data.
Mhm.
So
Yeah. Hopefully. There's a lot going on, a lot of interest in this area. So, we continue to provide support where we can, being the ones that, we don't know everything, but we have a good idea of what's really driving all of this. And our death records, unfortunately, show that, of the babies that didn't live to their first birthday. That's a task that we go through every month. As a matter of fact, this past Tuesday, we were reviewing. So, yep.
well, if there are no other questions, I will again thank you on behalf of the Jacksonville Urban League and our Center for Advocacy and Social Justice.
Yeah.
I want to thank you and thank everybody for attending. I see Kenny just came on. Did you have any comment? You have oh, you're clapping. Very good.
Yeah.
Very good. All right. Well,
Hey,
again,
Dennis?
yes.
Sorry, I just had one more token. I wanted to know, I think someone asked earlier, but if you want to take a look at some of those resources or research that was presented earlier, where do we find
Sure.
that information?
Just email me. We're in the process of updating our link to all of the data slides. So that should have happened yesterday, but I need to check with the team because I'll just give you the link to the website and you just go right there and all of those things are posted there. But if you just email me, I'll make sure to send that to either you so you can get it out. That'll be fine. Yeah, but it's on our website. It should be up, but I don't want to give that out and say then you go out there and it's not up. So just email me.
Alrighty, thank you.
Okay, all righty. You all take care. Thank you so much, Dennis. I appreciate it.
Thank you. And I'll put it, we have got another one of these coming up at the end of the month. So look forward to everyone joining us at that one as well.
Sounds good.
Have a great evening and a great rest of the week.
You too.
Thank you.
Thank you.